So NICE recommended cognitive behavioral therapy, commonly known as CBT, to help women combat symptoms like hot flushes, night sweats, and disrupted sleep. And this therapy involves discussing mental and emotional issues and finding practical solutions. Now, there are millions of women, and I'm sure if you are watching this and you are perimenopausal or menopausal or postmenopausal, you do remember those symptoms. Of course, I'm a 44-year-old man, but I do see patients in clinic all the time, and I do really empathize with what patients are going through, which is why I'm sharing this with you. So, hello and welcome to our weekly newsletter. I'm Dr. Dhesi. This is Vysana Live, and I'm excited to share with you some controversial stuff that's been happening in the world of medicine and aesthetics, and also just some hints and tips, what's been going on in clinic, and also some advice as well, and in regards to treatments and services that we offer. So if you haven't already, please do go over to YouTube and click on subscribe so that you can get notifications when we do post on YouTube. If you're watching this on your email, please do share it with anyone else that you think may benefit. And I look forward to sharing some more information with you. The mantra is mindfulness, menopause, and medicine. So what have I got to share with you today? So the National Institute of Clinical Excellence, which is NICE for short, recently published some information about how CBT, cognitive behavioral therapy, is a treatment or a recommended treatment for menopause. Now, this caused a lot of controversy, and let me go into that in a bit more detail. So NICE recommended cognitive behavioral therapy, commonly known as CBT, to help women combat symptoms like hot flushes, night sweats, and disrupted sleep. And this therapy involves discussing mental and emotional issues and finding practical solutions. Now, there are millions of women, and I'm sure if you are watching this and you are perimenopausal or menopausal or postmenopausal, you do remember those symptoms. Of course, I'm a 44-year-old man, but I do see patients in clinic all the time, and I do really empathize with what patients are going through, which is why I'm sharing this with you. So as I said, there are millions of women around the UK, hundreds of millions of women around the world who are going through these symptoms. But it's the understanding of the various treatment options available, which is why I'm sharing this information with you now. So NICE also emphasizes the need for personalized healthcare, and this means considering each individual's unique circumstances when discussing treatment. So CBT is not the only thing they're saying is, that's not the first line treatment. It's saying, look at your patient, or we look at our patients in a holistic way, and that CBT is a potential treatment for, especially for emotional mood changes, thought patterns, anxiety. It's a treatment they recommend. However, not everyone agrees fully with this approach. Dr. Louise Newson, who has done so much, she's a menopause specialist that runs the Newson Clinic, points out the limitations of CBT. And Dr. Newson emphasizes the established benefits of hormone replacement therapy, or HRT, in treating underlying hormone deficiency. So basically what that is that Dr. Newson says that just focusing and concentrating on CBT as a potential form of therapy, which I think is not the case. That's what NICE was saying, but obviously it can be taken in that context, is that CBT can't be used as the only therapy. So the controversy is that, again, organizations like NICE have let down women by just promoting one type of treatment or therapy, CBT, and not promoting the use of HRT for other symptoms. Now, NICE don't advocate HRT for treatment of anxiety or mood changes, but they do advocate as a primary choice for using HRT in things like hot flushes and those symptoms, but not necessarily things for mood or any of the other things that Dr. Newson was saying. It's always important that there are always risks and benefits with treatment, and that you need to discuss your concerns, your symptoms, with a qualified healthcare practitioner so they can look at your symptoms, look at the data, and match what would be appropriate for you. So I think that CBT is an effective treatment, but it's an adjunct, and I sort of agree with Dr. Newson that HRT is important. Not everyone can use HRT, and so therefore we do need to look at adjunct therapies like CBT. But again, it shouldn't be the only form of treatment. We should look at everything holistically. So I hope that made sense. I was waffling a little bit, but essentially a lot of controversy, a lot of backlash against the NICE guidance about using CBT as a way of treating menopausal changes. Really I think what advocates for HRT wanted was a more well-rounded summary and approach to help clinicians like myself, like general practitioners, approach women's symptoms in the right way. So moving on to skincare, and I'm going to talk a little bit about the concerns that patients present with. So we get a lot of questions about skin wrinkling, especially in the lower face around the smile line area, crepey skin, especially underneath the eye area, not necessarily the tear trough, but definitely under this area, and volume loss as well. So, you wake up in the morning and you can see that there's fine lines creeping in here. The skin, the texture, the quality is not so great. It's dehydrated. Skin has lost its glow. It's dull. It's sallow, such a horrible word, but I'm going to use it. And then, what can we do about that? What are the treatment options? Well, I keep talking about skin boosters because they're such an easy and relatively low risk profile treatment for these kind of skin changes. Now, they don't replace volume as well as dermal fillers do, but not everyone wants to have dermal fillers. And I think continued use of skin boosters is actually a good bridge in between. For example, dermal fillers I'll always advocate probably once a year, even once every 16 months. But skin boosters you can do every 3 months, in some cases every month if you wanted to. But I usually say every 3 to 9 months. And if you combine that with radio frequency, which can stimulate fibroblasts to produce more collagen, it really does help with skin dehydration. It really does help with helping that glow come back into the skin, that plumpness, and also help with those fine lines that are just creeping in as well. So that would be my go-to at this time of year, especially leading into December when you might be tired, you're not getting enough vitamin D, and that's another story for another time. But definitely skin boosters around. So a very quick treatment can be done in 30 minutes, and you can see the effects straight away, and then they carry on working. Because remember, skin cells renew over about 4 to 6 weeks. It takes time for those immature skin cells to migrate to the surface, and whilst that Profilo or skin boosters are in there, it really helps to promote the reduction of fine lines, giving a little bit of volume. I could go on about this forever, but I'll leave you with that. So yeah, Profilo, skin boosters, really good, useful treatment for those things if you're concerned about them. Lastly, let's talk about blood tests. When should I have a blood test? Do I need a blood test? What is a blood test for? Well, let's start with the problem first. So this time of year, recurrent coughs and colds. I keep getting unwell. I get better and then I get well. I've been to the doctors. I might have had a course of antibiotics. However, it's still happening for me. I feel tired. I feel fatigued. Is it an allergy? My skin is getting red and inflamed. I might be getting signs of what we call breakouts around the lower part of the face, blemishes. That could be hormonal. It could be allergy related. There's a whole host of things. So that comes to mind, like, how can I find out what could be done in clinic to help me find the answers to this? So recently we've been doing blood tests for patients. We're looking at their hormone levels. Some patients have come off HRT because we're getting side effects. So we looked at what their estrogen levels were doing, what their progesterone levels were doing, and we found that they're in the perimenopausal stage. We found that actually their hormone levels were in a really good place, and actually coming off HRT may have been the thing, and maybe reintroducing it later on. But again, when they get symptoms, hot flushes, irritability, weight gain, fatigue, joint pains, cognition, memory, I could go on again. So blood tests can help in that sense, and they can also help with identifying immunoglobulins or antibodies, which can then help to identify whether it is an allergen or whether it's to do with your immune system. So we helped one patient go through her immunoglobulin profile, and we found that actually the immunoglobulin that was high, sort of an antibody that was high, was due to allergens, and that started to make sense with how her skin was reacting and getting flare-ups, getting redness, getting rosacea flare-ups, and it was all to do with an allergen-related issue rather than a hormonal issue or rather than an immunity issue. So blood tests can be very useful, but again, it requires consultation. So that was the weekly newsletter for this week. I hope you found it useful. We've discussed controversy about NICE publishing their guidance on cognitive behavioral therapy as possibly the way to treat menopausal symptoms. The advocates for HRT, like Dr. Newson, are saying that's just not the great approach. It needs to be a holistic approach, and it can't be just using CBT. It's not good enough to help treat women's menopausal symptoms. We then went through skin problems that you may be experiencing, which is fine lines and wrinkles, loss of elasticity in the skin and texture. It just doesn't look great. It looks sallow, and what can I do? We talked about skin boosters, and lastly, talking about using blood tests and consultation to identify, is this an allergy-related issue or is it actually a, that's my cue, the lights are going out. I'll keep talking to end this video on, but I hope you found this useful. I'm Dr. Sunny Dhesi, this is Vysana Life, and this is our weekly newsletter, and the lights are out, and that's me signing off.